Yes.
Good afternoon, everybody. We meet again in Getting to Know Our EAWANET Community, brought to you by Triple Profit and EAWANET Community. The idea of this conversation is to get to know EAWANET community members. Today we have CHO joining us from Uganda with a couple of members, we will try during our short conversation to get to know the organization, their great impact in the field, their challenges, and their original solutions. So maybe we'll start with a short introduction. I will start. My name is Eldad Barber. I'm based in Israel. I'm the head founder of Triple Profit, based in Israel and in Eastern Africa, with the agenda to bridge between community cultures and different technologies, with the point of better quality of life and better life skills for those in need. EAWANET, Stella, you with us?
Yes, please. Thank you, Eldad, and thanks everyone for being part of the conversation. My name is Stella Akiteng, and I'm the coordinator for Eastern Africa Work Camps Association, which is EAWANET in short. In another capacity, I am program director for Intercultural Development Agency, which is IDA, also a member of EAWANET. But for purposes of this conversation, we'll focus majorly on EAWANET, and then CHO, which is a member. CHO Uganda is Community Hive Organization in Uganda, which is a member of EAWANET. Briefly, maybe before we go to the next person's introduction, the Eastern Africa Work Camps Association envisions an Eastern Africa community where the people have a mutual understanding and solidarity in their operations or way of living, or in whatever undertakings they take towards positive development. So we promote voluntarism, and then we also promote peace building in the region. Our major value, we are grounded on a value, or our operations are grounded on a value of I am because we are, which is an Ubuntu concept. So whoever joins us, EAWANET is a membership organization, so whoever joins us should be able to be driven by that value. So we aim to collaborate and network in order to enhance regional cooperation, intercultural exchange, and then solidarity. Because we believe that by strengthening the civic voice, we're able to contribute or catalyze the process of attaining positive sustainable development in the region. But also, we want to see that in our operations, we work with different regional undertakings, because we think that in the process, we are able to contribute to people-driven or people-centered development processes. For example, recently, EAWANET had the honor or privilege to be given the opportunity to participate in the Southern Africa People's Solidarity Network Summit, which was in August, and altogether contributing to a declaration that was submitted to SADC. So we believe that in addition to exchanging ideas, human resource, information and experience, not only within the network members, but also with other collaborators out, we contribute to humanity positively, not only in Eastern Africa, but among different general publics, irrespective of the geographical context. So one of the other things that we want to bridge in our operations is to, while we promote the North and South exchanges through voluntary service, we also want to see more of South to South exchanges. We want to see, even the North to North exchanges as we continue boosting the North and South exchanges. Briefly, that's that, Eldad. But also maybe just to add is that, for example, in an effort to contribute to global issues, for example, in this COVID-19, the members were able to work together and develop some proposed solutions, let's say, in handling the COVID-19 challenges brought about by the pandemic. So we've been able to develop papers, especially in the area of healthy food systems and livelihoods, and also proposing ways in which people should be able to recover, yeah, or maybe also prepare in case of future, similar outbreaks. So we believe that in an effort to enhance solidarity, learning, contributing to knowledge exchange and expertise is one way. To also contributing to sustainable development goals. Thank you.
Thank you, Stella, very much for this presentation. Godfrey, would you like to present the CHO members? Godfrey?
You're on mute, Godfrey.
Hello, members. Is it in Uganda? Is good morning. I don't know what is there now, what is the time there, but I'm Suga Godfrey, the vision bearer of Community Hive Organization in Uganda. And briefly, this is a youth-led CBO that was established in 2013 to contribute to the improving the living condition of older persons in Uganda, given the fact that is one of the target group that was put in a forgotten constituency. And two, I will not introduce my member. They will introduce themselves, please. I request let them introduce themselves such that they feel the environment. Thank you.
Thank you, Godfrey. Thank you very much.
Okay.
Can I take start? Like Godfrey said, here in Uganda is good morning. So good morning, ladies and gentlemen. My name is Emmanuel Patrick. I work with and for the persons in this country.
Patrick? Your communication is not as good. We cannot really hear you. Maybe we'll continue with Monja for now. If you can please check your communication so we can better hear you. We go back to you, okay? Monja, please.
You are fine, I can get you, right? Okay, but Godfrey is going to continue, I think.
Okay. Thank you so much, Eldad. Thank you, Richard, Stella, and everyone for organizing this meeting. Once again, my name is Monja Minsi. I come from CHO, and I'm a board member. I'm looking towards to discuss the meeting and also provide the relevant information.
Thank you, Monja. Thank you very much.
Hi, my name is Richard Waller. By profession, I'm a chartered engineer and have been visiting Uganda since 2014, volunteering with various projects. I retired from my full-time work here in the UK back in 2017. And over the last 2 or 3 years, I've been spending probably 4 or 5 months a year in Uganda, working with an organization called Scion International, working on various development projects. And it was part of that, as whilst I was there, that I came across Godfrey and the work of CHO, which I found particularly interesting and exciting. And since then, I've been doing my best to support Godfrey in the work that he's been doing.
Great, thank you very much.
Thank you very much, Richard.
So who would like to tell us a bit about CHO? Tell our viewers what is CHO is doing in the field, a bit of how it was established, what is it has been doing since, and how do you find the last year? How do you manage the last year and all its challenges? Please.
Eridad, I think I can ask who? Godfrey to do that, to give that background. Godfrey?
Okay. Hello, do you hear me?
Yes, we can hear you.
Hello? Okay, fine. Though we didn't allow Diana to introduce herself because we are looking at gender equality as well, but I don't know whether she's able to hear us. The moderator, is it okay if we can give her like a few seconds to introduce herself before I
of course, please.
Introduction?
But we're not sure she can hear us, so maybe you should start. And please, Diana, if you can hear us and you can join us, stop Godfrey and just enter the conversation. But for now, maybe till she joins us, Godfrey, if you can go.
Okay, thank you very much. CHO, as you heard, is a community hive organization that is based in Busukuma sub-county, and it started in 2013. It's after having a long sit with the members and given also my background. So realized that there is needed to play a role in advancing the rights of older persons, because if you see in our country, Uganda, old persons are left behind. And we should also remember that they have done a lot to the development of our nations, but they are not a priority as we would expect. So we came into force and we started operating in the Busukuma at a low pace because of the issues of financial resources and what here and there, and being the fact that the issues of aging, years of most Ugandans is still new. So they focus more on young people who have the energies to move here and there. Our mission is to promote their rights and also the rights of the grandchildren, the children they are living with, because as we are aware that almost 63% of the children, or orphans and vulnerable children, are cared for by the older persons who are living in traditional communities. Those are rural areas, and they are going through a number of struggles to make children live a better life. There is poverty that is increasing, elder abuse and neglect, stigma and discrimination, because the moment they see an older person cannot support his or herself, they are abdicated. They are left there without any kind of support and care. For us, we thought, no, we need to do something tangible. And given my background, much of an older woman went through a number of struggles to make me survive to reach this far. So that came into my mind. I said, no, I need to pay back, like paying back. What can I do to a number of older persons in this country such that they can realize their potential? Through us, we are what we are because of them. So humbly, and if I remember, we started with a clinic day where we blessed older persons in the community. We gave them free services. We got some simple one-off grant from Help Age International because We are members of National Social Protection and Livelihood Advocacy Group. We are serving as secretary. We are members of Uganda Reach the Aid Association, where Monja was, by then was an employee there. So we started like that. Of course, the number of hurdles or challenges, as you know, with of aging, their concern are not yet felt in the development of this country, being the fact that the population is small. I think 1.8 million people in Uganda are older persons, so it can't be felt well. But for us, we are saying no. And another thing is that youth are blamed for not supporting their grandmother, their grandfathers. But I realize that we have a role to play and we have the energies to make a contribution such that the community can know that even young people can front aging issues and leaving them in rural areas because of unemployment. Boys and girls move to urban centers looking for green pastures. And these people are left in the villages. And when we have children, we send them back, we send them to the villages, and they are by them. And we don't go back to support them where necessary. So that is the background. That's the gist of the story why CHO exists. We have engaged a number of national coalition to ensure that that the rights of older persons are organized, like the National Protection and Livelihood Advocacy Group, where the secretary by then. We also advocated for the establishment of the National Council for Older Persons, because I was the secretary. We have engaged in a number of discussions with the government line ministries to ensure that at least older persons have a place in the development of this country. And we even, if we add value, we added value to the scale up of the SAGE, Social Assistance Grant for Empowerment. Now, older persons in Uganda, they are getting their cash transfer, which is 25,000 shillings per month, which is not enough, but at least that is the beginning. Yeah, briefly, that is. We have a lot, but that's what I can say.
So maybe we can see a couple of pictures, and maybe Monja can share with us and explain what we'll see. Let's have a look. We took some pictures. What do you see here, for example? This is from your field work. Am I right?
Yes. That is true.
Can you explain us what we see? Monja?
Eddie, what I can say, this photo is that Godfrey had moved with our team and the community volunteers to meet groups of different older people and ensuring that sensitize them on different areas of HIV, areas of DBV, and also ensuring that they can have information around their rights as older people. But this was before the COVID-19 pandemic, and as a group of younger people, we also distribute a number of items to older people. For example, we saw a research by Helpage International where they were telling us that over 93% of older people are still sexually active and they are not using condoms. So the photograph you can see up there is Godfrey was trying to talk to them about issues of HIV, about issues of gender-based violence, and also ensuring that they can be sensitized on where they can get health care services. You can even see those other photos. You can even see an example where our health workers, the health workers from the public hospitals, public health facilities, are providing free health care to older people, and also the children that are under the care of older people. So basically, that's what I can explain about these photographs. But of course, recently, we, as CHO, we worked with the Helpage International, really to identify how has COVID-19 impacted on the lives of older people. So what we found out is that currently, because older persons are fragile, they can't go to the garden to dig, they have no money, they lack income. So you find that COVID has impacted on them. One, we found out that older people are having 1 meal a night, 1 meal a day, and sometimes others are going hungry. They are lacking access to water. They are lacking access to protection and safety. For example, there is a younger boy who was caught beating his mother. The mother was 60 years and above, but the boy was beating her seriously. So they are not protected, and nobody cares about the plight of older people. So the other thing is what we found out again was housing and shelter. Housing and shelter is one of the issues that older persons are grappling with during COVID. You can find that some of the children of these older people have abandoned them. They have run to Kampala, others were locked up in lockdown. They couldn't go back to support their fathers and mothers who are very old. So, yeah, so you find it's really very difficult for them. Then we found out that the health of older people is really fragile. They can't move to longer distances to access healthcare services. Nobody's providing psychosocial support. So in COVID-19, as a CHO, we are trying to move around, work with other community volunteers to make sure that we can provide psychosocial support to older people and ensure that we can also connect them to their relatives, to their children, such that they can talk. They can talk and present their problems to their relatives, and then they can get some support. But of course, because of limited resources, we are just a growing organization. We are not able to reach everywhere. But of course, we want to appreciate Richard. We want to Esther to also appreciate Eldad for organizing this. And we are seeing this as a great opportunity for us to grow and also maybe tap into fundraising opportunities and increase our budget to ensure that we can reach the population of older people and also the children that are under the care of older persons. Thank you.
You're doing a great job. It's amazing, especially during those challenging times. I'm sure that that you're making a great impact in the field. And as you mentioned, there's many old people that are being maybe forgotten by the government or by the kids. And by having those kinds of organizations, like the community hive organizations, they can get the psychosocial support and other supports as you go and meet them in the communities. I'm sure that our viewers will be very interesting to know how are you able to measure your impact in terms of after going and reaching out to the communities and meeting the elderlies and providing those supports, the various of support that you're providing them. How can you measure what is the impact that you're leaving behind eventually in the field?
Hello, can I? Hello?
Yes, Godfrey.
Yeah, go ahead, Godfrey.
Briefly, I saw there are some photos where you saw some young people, they have put their hands together. Mm-hmm. Did you see it?
Let's share it again.
It shows some kind of teamwork, and solidarity. Have you seen it? So that one will take us back to, will take us forward to how do we manage to sustain the interventions. Those are intern students. We get them from different universities who come to have their practice with us. So we engage them in the community. We design people interventions together. We prepare them, then we design together. Then we go to the community, we test the interventions. We mix them with the community youth to work as a team. So that picture shows a teamwork spirit. You get it?
Yeah.
Such that these university students who are there, what they learn there is the theory. It is most of what they learn is theory. So we bring them close to the community, work with the community to practice what they learned in class. So in reality, when they come on ground, they see things different. So we are trying to promote practical skills than theoretical knowledge. And you'll see in some photos, we took them out. They were constructing dry racks in the community, you get it? Engaging other community youth who are redundant, who are taking drugs. So we try to engage them such that they are productive in a society.
Yeah, maybe
so
we'll
go
share
back
it again.
Yes.
Yes, please.
Yeah, if we go back to your question, how do you measure the impact and what? One, we have on the ground, we have two groups of volunteers. One, the other one of the youth, and another one for older persons, the active aging, who are helping with the grassroots mobilization of these older persons. In case we have an activity or services provide to the community, they go out and mobilize them for the services, because some of them are unable to reach the centers. So they help them with some transport. You know, there is a way community service is done by these young people. We hear testimonies from them. We get testimonies from the volunteers that, this older person is like this and that and that. That gives us hope. And it motivates us further to continue serving despite the fact that we still have financial challenges. But at least once in a while, when you hear a call, a volunteer says, we are able to support this older person. We went to a household, we supported the older person with maybe fetching water, cleaning the household, the house, cleaning the compound. So it really motivates us more. Even I can give you an example. There is a clinic within the community, a smaller clinic that is headed by a young lady. But when I went there one time, I found her in the house of an older person providing Panadol. It was little service, but at least we made a change. We managed to change the attitude of that lady, that she can be able to meet or to visit an older person and check the welfare, check out how the older person is feeling. So that to me, that was great achievement. We cannot report many because we achieved less, but they are tangible, they are visible. There are some other instances where a youth reported that this older person was bedridden. She had no money, but they brought the boda, this public transport, and they took her to the health facility. But unfortunately, reaching there, they didn't have medicine required to treat the older person. You get it? And you know, in Uganda, we don't have geriatric services. So there are some challenges, but at least we managed to have that short-term outcome.
That's amazing. It's amazing, and we can definitely see it. Can definitely see it by the pictures. Your tremendous work in the field. Sorry guys. Maybe just because we have a couple of minutes left, maybe Stella would like to to join in and to ask a question?
Yeah.
Stella?
Thank you, Eldad. And thank you, Eldad. And thank you for the CHO team for the discussion facilitated. I'm particularly interested in learning about your lessons learned. We know that that as one of the reasons that we're having the aged or the elderly being neglected is because of the breakdown of the African traditional systems. We know that in the past, the system was that the village or the clan takes care of children. It's a responsibility of everyone to take care of a child well in society. Secondly, also the aged, when they grow old, it's supposed to be the traditional, the system, the clan, the family, the village to take care of these old people. So now, I would love to know what are your lessons learned? We've seen the best practices. What are your lessons learned in your effort to address the underlying issues towards, because clearly we see that you're overriding, you're not paying attention to the addressing symptoms, but you're trying to address the underlying issues. So what have been your lessons, purposes of learning? Thank you.
Can I deliberate on that? One of the things that we've learned as a CHO is putting older people at the center of planning, and also at the center of implementing some of these interventions. Because what we have observed is that being a group of younger people that are supporting older people in the communities, we felt that, for example, if we are providing psychosocial support, counseling around HIV, older people want to talk to their peers. They want to talk to fellow senior citizens. They want to talk to fellow older people because they believe in each other. So in that line, like Godfrey explained earlier, we have a group of older people called older citizen monitoring groups. They're called older citizen monitoring groups. So these groups, the members are older persons themselves. First of all, they are helping to track how many older persons are accessing health care services, how many older people are accessing social protection services like the social assistance grant for empowerment. They are also helping to track how many older people are experiencing GBV. They are experiencing violence because of their land, because of they are fragile. Someone comes in, wants to grab their land and all that. So we are saying that everything, right from planning to implementation, older people need to be put at the center. Then the other lesson we have learned is that we have worked with the government of Uganda through Ministry of Gender, and Patrick is a witness to this. Government has come up with policies. There are very good policies in the country around older people, like the social protection policy for older people. There is also older persons policy, which was passed in 2010, but also reviewed some 1 year ago. But you can find some of these policies are not implemented. They are not implemented by the government of Uganda. So as a CHO, being an advocate organization for older persons' rights, we are working with older people through age demands action campaigns to ensure that some of these policies can be implemented. We are also working with the community development officers to make sure that older persons can be included in some of the discussions around the country. But of course, it's very important, even when they are writing a policy, older persons can be asked such that the technical people who are writing can have consultative dialogues with older people, ask them about their issues, and then they are able to put them in that. But also, being a group of younger people, we have also observed that over 63% of care over 63% of older persons are taking care of people living with HIV, orphans.
Monja, I'm sorry, I have to stop you in the middle.
Okay.
But our time is out. So I want to thank everybody for joining us. It's been a great pleasure